Hello and welcome to Radiance Revealed, the podcast. I'm your host, Dr. Jen Haley. I'm a board certified dermatologist, fitness enthusiast, nutrition expert, and global explorer that over the years has uncovered that your skin is a true representation of your internal health. Each week, we will chat with leading health, wellness, and even spiritual experts who will reveal secrets to true health and vitality. My goal is to help you change small habits to give you the power to create a more balanced, aligned, and elevated version of yourself. Now let's dive in. Hi, everyone. Welcome to this week's episode of the Radiance Revealed podcast. And I'm your host, Dr. Jen Haley, board certified dermatologist for 21 years now. Don't know where the time went. So I wanted to discuss the difference. What is the difference between rosacea and sensitive skin? They're often confused because if you have rosacea or you have sensitive skin, you might notice that your skin has redness, irritation, burning, stinging, and even dryness. But there is a difference, and they're treated differently and they have different outcomes. So when we're looking at sensitive skin and rosacea, basically everyone with rosacea has sensitive skin, but not everyone with sensitive skin has rosacea. Sensitive skin is usually from a compromised skin barrier. So we have a wonderful skin barrier that keeps the good parts of us in and doesn't allow the bad stuff in, right? So it keeps the germs and it keeps the chemicals in our environment outside of our body. And when our skin barrier is broken down, then things that normally wouldn't irritate us can start to irritate us. So how can this happen? Basically, weather changes can do this. During the fall to the winter is a big time when I'll see a surge in sensitive skin cases because the wind, the cold, the decrease in humidity in the environment can break down the skin barrier from what it was in the summer. So I have people look, the easiest thing to do before we start adding things to someone's regimen is what can they be doing at home that may be contributing to breaking down the skin barrier? And I'd say probably the most common thing is overuse of soap. I like people to use a non-soap cleanser. So a soap is usually alkaline. Your skin is typically acidic. It runs mildly acidic. So it doesn't like an alkaline environment. So you want to look for a cleanser that is not a soap-based cleanser. And that often means it doesn't suds up. And that's okay. It's still going to cleanse your skin without forming suds. When you have that surfactant, that sudsing effect, it's basically the soap molecule binding with the natural oils in your skin that you especially need in the dry winter months that pulls out that moisture from your skin. And if you think of your skin as a brick and mortar model, basically the cells are the bricks and the fatty acids, the lipids in between, the ceramides, things like that are in between the bricks to hold the bricks together. We need those fats. We need those compounds in order to keep the bricks from falling apart. And when those compounds are removed, the bricks sort of crumble, and that's what contributes to dryness and irritation and scaling and redness. So take a look at what you're using on your skin. Make sure it's a non-soap, gentle cleanser. And that's really all you need. The only time you need an actual harsh soap is if you're working with grease, if you are oil painting, if you're working with motor oil and you have a lot of grease on your skin, then you may need a harsher soap. But for most people, for 98%, 99% of the people out there, using a soap is going to tear up the skin barrier. So if you're dealing with sensitivity, that's the first thing is just take a look at the soap you're using and make sure it's a cleanser. The second thing I have people look at is assuring that their products that they're applying are very few and have very few ingredients. So you want to avoid anything that has fragrance in it because fragrance can be extremely irritating to skin. And this is for both sensitive skin and rosacea-prone skin. So avoid fragrances, avoid as many chemicals as possible, and look for skincare that is simple, that has as fewest ingredients as possible. And then you may need to take a break on exfoliation because exfoliation is basically going to break down the skin barrier more. So I love exfoliation. I really, really love people to exfoliate, but you have to listen to your skin intuitively on if you need to exfoliate more or less. So the minute you start getting any burning or sensitivity to your skin, you're exfoliating too much and you're going to want to back off. So if you're struggling with rosacea, or sensitive skin, hold off on the exfoliation until we have it under control. And then the last thing is friction. So sometimes you could just get irritation from friction. So I see that often with people who work out a lot that have repetitive motions, runners, just any sort of repetitive motion, not necessarily on the face, but other areas of the body. And I ran a couple of marathons years and years ago. And I just remember after the repetitive motion for 26 plus miles, there are certain areas of my body where I had deep sores from the friction tearing up my skin. So that's what happens. So, as opposed to sensitive skin, rosacea is caused by vasomotor instability. And that basically means that the blood vessels are not stable. So, right now, even when I'm talking, you could see I might get a little blush because I have rosacea. And rosacea is that vasomotor instability. Now, most people with rosacea also struggle with sensitive skin, but not everyone with sensitive skin has rosacea. So there are different forms of rosacea and they present differently and they're also treated differently. And one form doesn't necessarily progress to the next form. So the first form of rosacea it's called erythematotelangiectatic form. And it's basically people when we get flushed and then it goes away. Flushed goes away. Now, if this process happens again and again and again, the blood vessels get flushed so many times and expand that sometimes they stay there. And you could see your skin when you wash your makeup and your sunscreen off at night, you can see you have a lot of blood vessels on your face. And that's the erythematotelangiectatic form of rosacea. The second form is the papulopustular form of rosacea, and that will sometimes be called acne rosacea because it looks like acne. But what's the difference between the papulopustular form of rosacea and acne in adults is that acne has comedones or blackheads, and we do not see blackheads in rosacea. So that's how we tell the difference. Also, papulopustular rosacea tends to be centrofacial. So it tends to be on the medial part of the cheeks, the chin, and the forehead. Sometimes it's just in one of those areas, but it tends to be in those areas and have that persistent redness to it. Can be whiteheads, can be juicy red papules, but you do not see comedones. The third type of rosacea is phymatous rosacea, and that looks like the big W.C. Fields nose. And typically with the phymatous rosacea, we see an overabundance and overgrowth of sebaceous glands or oil glands. And this is very hard to treat because it's a growth that needs to be removed, so it's a lot better to prevent. And then the other thing a lot of people are not aware of is that with rosacea, you can have eye involvement. So you may feel a gritty feeling in your eye, like there's sand in your eye. It might just have some redness, some dryness. And this can often be because of occlusion or blockage of the meibomian glands in the eyes. So you can have rosacea in your eyes. So we have different areas of our body and they're all connected on the inside. So we are finding more and more evidence that rosacea can be associated with the eyes, the skin, and also your gut health. So we have evidence that small intestinal bacterial overgrowth, also called SIBO, is associated with worsening of somebody's rosacea. So we want to take a look at the gut. Okay, so I just want to note that just because you have one form of rosacea doesn't mean you're going to progress to another form of rosacea. They are pretty separate. I personally have had rosacea for many, many years. I know my triggers. I'm going to discuss some triggers with you. And avoiding the triggers is really key in helping prevent progression of rosacea over time. And the other thing is that you can control your rosacea through lifestyle to the point where the blood vessels become stable and it's not so much of a struggle. So if you're struggling with it on a daily basis today, just know that you can retrain your blood vessels to the point where they're stable and you won't have to be so intense with training them. Okay, so what are some of the triggers? Pretty much it varies for everyone, but a universal trigger is sun exposure. So heat, sun exposure is going to make rosacea worse because it's going to dilate the blood vessels. And anything that's going to dilate the blood vessels when they're not stable can make rosacea worse. So sun exposure, temperature extremes. Personally, when I go from skiing to next to a hot fire, my face blows up and gets red. So I know that if I'm in the cold, I don't go straight to the fire. I ease into the warmth, and that's how I can keep it under control. This is what works for me. You will have to pay attention to some of these triggers and what can make it worse for you. So I often find that the best thing to do is to avoid all of the things at once. And then once it's under control, slowly reintroduce one thing at a time and see what causes a flare for you. Sun exposure, temperature extremes, stress. Can't stress just make everything worse. Spicy foods and hot beverages can make it worse in some people because they dilate the blood vessels. Alcohol usually makes it worse in most people. Some alcohol can make it worse than others, red wine in particular for a lot of people. Sauna can make it worse. Okay, sauna, steam room, hot yoga can make it worse. You'll know when everyone else around the room, the redness has gone away in their face, 2 hours later, yours is still there. You know it's making it worse for you. And then even heavy exercise, so like a heavy run or heavy vigorous exercise that expands the blood vessels can make it worse temporarily. And then all topical irritants, so anything that's going to cause sensitive skin to get worse can also make rosacea worse temporarily. And I don't like fragrances in skincare. I really recommend people use as few ingredients as possible and avoid fragrances. And then, as I mentioned, gut dysbiosis, which means an unhealthy gut, which most of us are living with in this chemical loaded society filled with glyphosate and not proper nutrients, can definitely make rosacea worse. So we'll talk about what to eat. And then sometimes Demodex mite overgrowth. We all have Demodex on our skin, but if they're overgrown and they're out of balance, then it can get worse. So often Demodex mites will overgrow if we exfoliate too much. So just remember, don't exfoliate too much and focus on the skin barrier. And then topical skincare, really, I like people to look at for sensitive skin. Let's talk about sensitive skin, topical skincare. So as I mentioned, fewer ingredients. Choose products with few ingredients, both topically and in the diet. So when we're looking at our food that we're eating, if it has one ingredient, avocado, salmon, broccoli, those are the foods we want to eat. If it's in a package and it has 20 or 30 ingredients, we don't really want that. Our body does not identify packaged food as nutrients, as food. So what happens is our body, our liver, all of our detox organs have to remove all of the chemicals from the processed food and extract what little nutrients it can. So it kind of gets worn out in the process, right? So the more real whole foods we eat, the better. No one's perfect. No one is perfect. But if you could do it 80% of the time, that's great. If you could do it 90% of the time, that's even better. So less ingredients in our food. The other thing about preservatives in food, so when something's in a package, it has a lot of preservatives in it so that the food can stay on the shelf for a year, longer, a couple years even. And those preservatives are to prevent bacterial and microbe overgrowth in the food. But what does our body consist of? What is our skin connected to on the inside that controls the health of our skin is our gut. So if we are consuming preservatives, these preservatives are going in our body and they're destroying our own gut microbiome, which is harming us in the long run. Okay. So few ingredients in skincare, few ingredients in the foods we eat. Avoid products on your skin that rapidly evaporate because they usually have alcohol in them, and alcohol is going to break down the skin barrier. And then anything that burns your skin or irritates your skin doesn't belong on your skin. If it worked for your neighbor, if it worked for your best friend, if it worked for your husband or your wife, that's fine. If it doesn't feel good on your skin, I want you to start listening to your skin, not externally listening to everyone else out there. You can try it. How does it feel? Does it feel good for me? Yes or no? That's all that matters, okay? That's the major message I want you to get out of here is start attuning to yourself. Okay. And then as far as topical skincare, so include gentle cleansers, no soaps, a moisturizer, look for ingredients with hyaluronic acid, ceramides, which is the mortar that fills in between the bricks to help improve the skin barrier. You can look for dimethicone or shea butter, okay? No olive oil on the skin. It's very, very inflammatory. I don't like coconut oil because it makes you prone to comedones or blackheads. But shea butter is totally fine. Hyaluronic acid, dimethicone, and ceramides. I love it. Improves the skin barrier and it reduces transepidermal water loss, TEWL, TEWL, and improves that skin barrier. Avoid exfoliants until you're well stabilized and you're not experiencing burning and redness and peeling. And retinol. So let's talk about retinol. So it's really interesting because while retinol can make rosacea worse short term because it disturbs the skin barrier, over the long term, it actually makes rosacea more stable and better because it stabilizes the blood vessels. So you really need to go very slow with retinol. So if your rosacea is very, very active and you're having a bad flare, put the retinol away. Don't use it right now. Once it's stable and it's under control, I will recommend people apply a pea-sized amount of retinol to their finger, size of a pearl, size of a pea. Apply your ceramide-rich moisturizer. Dab, 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 dab. Rub in your retinol. Let it dry. And then put another layer of your ceramide-rich moisturizer. And that's a sandwich technique. So does it reduce the availability of retinol? Yes, it does, but it also helps you tolerate it. And if you're doing that twice a week for 2 to 3 weeks and you're not having any irritation, go ahead and go to 3 times a week for another 2 to 3 weeks. This is at night after cleansing. No irritation after 2 to 3 weeks, go to 4 times a week. But really, the science shows that if you're using it 3 times a week or more, you're going to see benefit from retinol at 6 months out. If you can get to every night, that's great. But you want to start low, do the sandwich technique, ceramide moisturizer, retinol, ceramide moisturizer. The end. That's all you need at night. Okay. Gradually increase over time, increasing 1 night per week every 2 weeks. You have to be patient. We are in the long game. And your skin will not be on a roller coaster ride if you are gradually increasing things over time. Always taking a look at your skincare every season, because as the seasons change, our skin is in constant homeostasis with the environment, and we're going to have to adjust accordingly. So, okay, avoid the exfoliants, retinol slow once you're stable, and then SPF every single morning with zinc oxide, chemical free. Make sure there's no chemicals. It's just zinc oxide, SPF every day. Even if you think you're not going to be in the sun, you need SPF as your last step in the morning before you leave the house because you're getting UV radiation through the windows when you're walking to and from the car. You're getting it. You're getting blue light. You're getting other light that can be damaging your skin. So just apply it. Make it a habit. So there's other ingredients you can look for in cosmeceuticals for rosacea-prone skin or sensitive skin. And those are allantoin, ALLANTOIN, caffeine, because caffeine can constrict blood vessels. I especially like it around the eye, but it can be in a low percentage for a face, in a face cream, in a multi-purpose face cream. Feverfew is really calming, and so is green tea, and that has some caffeine in it as well. And then niacinamide in a percentage less than 5%. Sometimes niacinamide can be overdone. If you have a niacinamide serum and then a niacinamide moisturizer, you're applying too much niacinamide and it can backfire and it can actually cause more irritation. And then the other thing I really want people to be aware of if they have rosacea-prone skin is it might be tempting to apply topical steroids like hydrocortisone because topical steroids constrict blood vessels. So it can make the rosacea temporarily look better, but you can get a rebound effect. And I've seen this so many times year after year with patients who either use something that was in their cabinet for themselves or another family member, and they used it very, very long term, and the skin can get addicted to it. And it's called steroid addiction. And basically, it's sort of like if you use Afrin every single day, it constricts the blood vessels in your nose. And then when you stop using it, you get a rebound flaring of it. The same thing happens with using topical steroids every single day. It constricts the blood vessels. And then when you stop, you can look like you have acne and really bad rosacea and a rash that can last many, many months and take us a really long time to get off the topical steroids. So I recommend people avoid them altogether. The only time I'll recommend it is if someone has, like, a photo shoot and they just wanna do it one day and they're one and done, but I really wanna caution you against using topical steroids on your skin long term. It can cause so many problems from thinning of the skin, stretch mark formation, and blood vessel development, so less is more. Okay, so free cleansers, I'm not gonna say that too much. And then if you can't get this under control at home, definitely go see your board certified dermatologist. This is what we do. These are general guidelines I'm sharing today, but in the office, there's always a bespoke approach. And sometimes we'll use topical and even oral medications to help get rosacea under control. We might use topical ivermectin if we see a Demodex overgrowth. We might use topical metronidazole. We might use topical azelaic acid. There's a lot of topical medications. And then sometimes we will actually use oral medications as well, depending on the situation and how the rosacea is presenting and whether or not there's eye involvement. And also, if someone is exhibiting blood vessels, that there's a difference between redness that comes and goes versus blood vessels that have stayed and set up home. So once there's a blood vessel there, there's no topical cream or oral medication or diet or supplement that will make it go away. At that point, we need to pull out lasers and target blood vessels. So if you're someone that has blood vessels all over, definitely go see your board certified dermatologist to treat with a laser in the office. Okay, and then identify your triggers and avoid your triggers. Most people pretty much know their triggers, but a lot of us are in denial over exercise and SPF for sure. Okay, so my favorite part, what I often will do is I'll often give someone medical therapy in the office because I know I'll get a quicker result with the medical therapy. And then for the long term, we talk about diet and we talk about supplements and lifestyle. So avoiding triggers, adjusting the diet, and maybe adding some supplements because the medical therapies like laser or topical or oral medications are going to work quicker, but we don't want you to be on those forever. And while they work, now let's start initiating the lifestyle so that long term your rosacea is under really good control or even clear because you may have rosacea. Like, for instance, I have rosacea, but very rare does it even come out anymore because I've stabilized it so much. And that's how I can get to the point with most of my patients. We can get it where we're not going to cure you necessarily, but nobody will even know you have it and it's not going to interfere in your life. And that's really where we want to be, right? Okay, so diet, real foods, Mediterranean, I'm going to say a modified Mediterranean diet because there's certain foods in the Mediterranean diet that can actually worsen rosacea. So a modified Mediterranean diet, basically colorful fruits, vegetables, healthy cold water fish are amazing, regeneratively farmed meat, eggs, things like that. Great. Just real food. Eat as much real food as possible. I like people to go organic. There's a lot of controversy on organic right now. Go to ewg.org. They always have the Dirty Dozen and the Clean 15. So which foods you should really get that are organic and which foods doesn't matter so much, right? Like foods like bananas or avocados that have a really thick skin that you take off anyway. So the pesticides usually don't penetrate, but they do with peaches and apples and things like that. So go check out the EWG to know what fruits and vegetables to choose for organic. Okay, so avoid those hot beverages, the spicy foods. I'd cut out the alcohol until you get your rosacea under control. And then you want to avoid foods that are high in cinnamaldehyde. So that basically is cinnamon. So avoid cinnamon, avoid tomatoes, and avoid citrus fruits. Those are three big triggers for rosacea. Bump up the omega-3 fatty acids. As I mentioned, cold water fish, flaxseed, and walnuts. Those are great. Those are great foods to eat if you have rosacea. And then consider, because we know that rosacea is associated with small intestinal bacterial overgrowth. So you want to consider adding prebiotics and probiotics. Now, this is very complicated. I could do probably 5 podcasts on this, and I'm nowhere near an expert in it. But if you go so crazy into adding a ton of prebiotics and a bunch of probiotic rich foods, you can make the war inside your gut a little bit worse. So ease into it. So prebiotics are basically, you can add prebiotics from a powder. Some people do okay with this, some people don't. I do like people to add a little bit every day. And that's basically just fiber. So you can get it from your food. So prebiotic fiber rich foods. That's a good choice. And then probiotics, it's always best to get from foods like kefir, sauerkraut, kimchi, yogurt. I like sauerkraut and kimchi. I feel like those are the best. And there's also, as far as probiotics, there's some studies showing that Lactobacillus paracasei has been promising in treating rosacea. It's really about diversity. It's about making our gut as diverse as possible. And it's really fascinating because if you go travel, your gut microbiome can change that quickly within a week or two, as opposed to when you come back. If you hang out with certain friends, if you kiss your partner, your gut microbiome is going to change. It changes all the time. So I think that the more diverse it is, the better it's going to be in the long term. But if you've had stomach issues for a long period of time, you're not going to tolerate changing it up so quickly. So I can't just say, buy this one probiotic. It's just really about diversity. And I personally have played around with it for years, and I just keep rotating different probiotics. Who knows what's even getting down there at this point? So eating foods that are fermented foods, I think, are always your best bet, especially when it comes to like kimchis and sauerkrauts, because I'm not like a dairy. I don't really tolerate dairy very well. Although I do give my dog yogurt. And he loves it, and he does really well with it. So it's just a personal thing. What feels good for you? Okay, so that's the diet. Basically, the diet that's going to help your skin no matter what your skin condition. This is a little bit more refined for rosacea, but you're not going to have, this is going to help all skin conditions to follow this. Supplements. Okay, supplements. I can't really give you dosages because a lot of the dosages depend on what your medical practitioner is going to recommend based off of any other medical conditions you might have, or if you have your vitamin D level checked, it will adjust depending on what your vitamin D level is. So vitamin D3 is a supplement most people need to have. I have never seen anyone overdose with 5,000 IU per day of vitamin D3 with K2 added to it. But once again, you want to check a baseline and then have your doctor adjust that accordingly. I aim in the United States for 50 to 80 in the blood. So to be the blood level in your blood. Omega-3 fatty acids, it can thin your blood. So you need to make sure you don't have any other conditions and you're cleared by your doctor before you start taking omega-3 fatty acids. 2,000 milligrams a day is usually a good starting dose, a good amount for most people. I have seen people get into trouble with taking too much omega-3 fatty acids. I had a patient years ago who she said she was taking omega-3s. This was about 15 years ago. And I did filler in her face, and I always did it with no problem. And then this day in particular, I was putting filler in her face, and she was just getting hematomas, big, giant bruises everywhere. And I was like, I can't inject anymore. What's going on? Is everything okay with you? And she said she was taking omega-3 fatty acids, and she felt really good. So she decided to take 20,000. milligrams a day. So it just thinned her blood too much. So just remember there's really no solutions, there's trade offs. So with everything that we do in this world, we have to weigh the risks and the benefits. Okay, so omega-3 fatty acids, vitamin D3, make sure both of those are optimized. It's really nice if you can get an omega-3 to omega-6 ratio tested. It's a newer test. I supplement, I eat a lot of fish, and my levels were not very optimized, so I've had to increase my omega-3 fatty acid intake. Zinc, about 30 milligrams a day is what I recommend as a safe level for most people. And then green tea extract, quercetin, which is nice because it's a senolytic, so it can help remove some senescent cells from the body. They can also mess up your estrogen levels and decrease estrogen levels. So just remember, more is not better. And curcumin. So curcumin can also help. And, while sensitive skin and rosacea are overlapping because you can have redness, peeling, burning, and dryness with both conditions, there are differences. And there are different times a year that you may be prone to one more than the other. So I'm hoping that some of these guidelines were helpful for you. Please keep sending me DMs at Dr. Jen Haley, DrJenHaley, because this gives me ideas of what you want to hear because I'm here for you. And I want to share my knowledge in the most integrative, holistic way that is science-backed to help you gain control over your own health. And what can you do every single day on a daily basis that can bring you to full vitality, full radiance, and show up being your best self? So if you like this podcast, please subscribe, rate and review it, and share it with a friend. And I will see you next week. Bye-bye. If you're enjoying the Radiance Revealed podcast, please don't forget to subscribe so you'll always know when there's a new episode. And while you're at it, please give us a review, as that helps others to find this podcast. And if you want to connect with me, please visit my website, drjenhaley.com, or you can find me on Instagram at drjenhaley.
Hello, everyone. Just a friendly reminder that this podcast is for educational and informational purposes only. The statements and views expressed on this podcast are not medical advice. Opinions of guests are their own, and this podcast does not endorse or accept responsibility made for statements made by guests. Neither this podcast nor any of the information contained within it are a substitute for care by a qualified medical professional. This podcast is provided with the understanding that it does not constitute medical or professional advice or services. If you are looking for help in your journey, please seek out a qualified medical practitioner.